All right, future nurses, get ready, because today we are going deep on a topic that is absolutely key to your nursing practice.
It really is.
Fluid electrolyte and acid-base balance.
You'll be seeing this in action every day at the bedside.
Every single day.
It's pretty amazing how easily we take this intricate balance for granted.
I know, right?
Our bodies are constantly working behind the scenes to keep everything in check.
Exactly. And as nurses, we need to understand not only how this balance works, but what happens when things go wrong.
Yeah.
We'll be looking at some real-life examples from our source material today. Like we have this young college student dealing with the effects of dehydration and an older patient facing a potentially life-threatening situation due to fluid excess.
It's pretty scary.
Yeah, so these cases will really help you see how these seemingly simple imbalances can cascade into serious complications if they're not caught and addressed early on.
Exactly.
Okay, let's start with the fundamentals.
Where?
What exactly are body fluids and why are they so vital?
Well, you can think of body fluids as the internal ocean that bathes every single cell in your body.
Ooh, I like that.
It's not just water, though. It's a very precise solution of water and dissolved substances like electrolytes.
Okay.
Which we'll get to a bit later.
So it's like a transportation system for everything.
Exactly.
On a microscopic level.
It carries nutrients to the cells, removes waste products, helps regulate temperature, and even lubricates joints.
Wow.
Without the right balance of fluids, our body simply couldn't function.
And you mentioned that these fluids aren't just randomly sloshing around. They're organized into these compartments.
Right. We have the intracellular fluid, or ICF, which is all the fluid inside of our cells.
Okay.
And then the extracellular fluid, or ECF, and that's everything outside the cells.
Gotcha. So it's like having two separate pools of fluid.
Precisely.
Each with its own unique composition.
Exactly. And maintaining the right balance between these compartments is crucial.
Okay.
And we even have a third, often overlooked compartment called the transcellular space, where fluid can sometimes get trapped and cause problems.
Okay, interesting. We'll have to get back to that later.
Yeah.
But first, let's talk about this concept of total body water.
Okay.
What is that all about?
Total body water just refers to the total amount of water in the body expressed as a percentage of body weight.
Okay.
Simple as that.
And this percentage varies from person to person, right?
Absolutely. Several factors influence total body water, including age, biological sex, and body fat percentage.
Oh, interesting.
For example, infants have a much higher percentage of their body weight as water, especially in the ECF.
Okay.
Which is one reason why they're so vulnerable to dehydration.
That makes sense. Their little bodies are still figuring out how to regulate that fluid balance.
Right. And then on the other end of the spectrum, as we age, our total body water percentage gradually decreases.
Okay.
And this is partly due to just a natural decrease in muscle mass and an increase in body fat.
So those changes in body composition actually impact how much fluid our bodies can hold.
Exactly. And that's why it's so important to consider those individual factors when you're assessing a patient's fluid status.
Right.
What's normal for a healthy young adult might not be normal for an elderly patient or an infant.
Right. Okay, that's fascinating.
Yeah.
Now let's shift gears and talk about electrolytes.
Okay.
These seem to be the unsung heroes of fluid balance.
They are indeed. Electrolytes are minerals that carry an electrical charge when they're dissolved in fluid.
Okay.
So think of them as the tiny powerhouses that drive countless processes in the body.
So they're not just passively floating around in those fluids.
Not at all. They're involved in everything from muscle contractions and nerve impulses to regulating heartbeat and maintaining that crucial balance between the ICF and ECF.
Wow, they sound really important.
They absolutely are. And as nurses, you'll need to be familiar with the major players in each category. The positively charged cations,
Okay.
like sodium, potassium, and calcium.
Gotcha.
And the negatively charged anions,
Right.
like chloride, bicarbonate, and phosphate.
Okay, so we've got our positive and negatives.
Yep.
And the concentrations of these electrolytes differ between the ICF and the ECF, right?
Exactly. Maintaining those concentration gradients is essential for things like nerve conduction and muscle function.
Okay.
For example, potassium is the major cation inside cells,
Okay.
while sodium dominates the extracellular space.
So it's not just about having enough electrolytes. It's about having them in the right places.
Precisely. Yeah. And you'll be learning all about specific electrolyte imbalances
Yeah.
and how they can manifest in patients as you go through your program.
I'm already starting to see how these concepts connect to what we've been learning about the different body systems.
Exactly. It all ties together.
Speaking of connections, let's talk about how the body actually regulates this complex, dance of fluids and electrolytes.
Oh, it's amazing. It's like a symphony of mechanisms.
Right.
From the thirst mechanism that signals when we need to drink to a variety of transport processes that ensure that fluids and electrolytes are moving where they need to be.
Okay, let's break those down a bit further.
Okay, let's start with osmosis. Osmosis is the movement of water across a semi-permeable membrane, like our cell membranes, from an area of high water concentration to an area of low water concentration. Think of it as water trying to even out the party on both sides of a membrane.
So if there's a higher concentration of solutes on one side of the membrane, water will move to that side to try to dilute it.
Exactly. And this process is crucial for regulating the volume and composition of both the ICF and ECF. Now, diffusion is similar to osmosis, but in this case, it's the solutes themselves that are moving, from an area of high concentration to an area of low concentration.
Like when you spray air freshener in one corner of a room,
Yeah.
and eventually you can smell it everywhere.
Perfect analogy.
Yeah.
That's diffusion in action. That's how things like oxygen and carbon dioxide move between the lungs and the blood. Now, active transport is a bit different. It requires energy because it moves solutes against their concentration gradient, meaning from an area of low concentration to an area of high concentration.
So it's like swimming upstream.
Yeah.
The cells have to put in some effort to make this happen.
Precisely. And this is essential for maintaining that specific electrolyte balance within our cells. A prime example is the sodium-potassium pump, which constantly works to keep potassium levels high inside cells and sodium levels high outside.
That makes sense. And what about filtration? Where does that fit in?
Filtration involves pressure gradients. It's the movement of fluid in small solutes across a membrane from an area of high pressure to an area of low pressure.
Okay.
Think of how our kidneys filter waste products from the blood to create urine.
So it's like a sieve that allows some things to pass through while holding back others.
Exactly. And this pressure-driven filtration is also how nutrients and fluids are exchanged between capillaries and the surrounding tissues.
Wow, these transport processes are pretty amazing.
They are, and they don't act alone. We also have a whole cast of organs and systems involved in this intricate dance of fluid and electrolyte balance.
Like the kidneys. They seem to be the MVPs of fluid regulation.
Absolutely. They filter waste products, regulate blood volume and pressure, and they fine-tune electrolyte balance. They're like the body's sophisticated filtration and recycling plant all rolled into one.
Very impressive. And we can't forget about the heart,
Right.
which pumps blood throughout the body, providing that pressure that drives filtration.
Right. And the lungs, which help regulate acid-base balance by removing carbon dioxide, and the adrenal glands,
Right.
which produce aldosterone, a hormone that helps regulate sodium and potassium levels. Even the pituitary gland gets in on the action releasing antidiuretic hormone, or ADH, which controls water reabsorption in the kidneys.
It's incredible how all these different systems work together so seamlessly.
Like, really cool.
But as we know, things can go wrong.
Yeah.
And that's when we see those fluid and electrolyte imbalances.
Exactly. And that's where your skills as nurses become so crucial.
Yeah?
You'll need to be able to recognize those subtle cues,
Right.
intervene effectively, and advocate for your patient's well-being.
Let's start by talking about those fluid imbalances. We know there are two main categories, fluid volume deficit and fluid volume excess.
Right. Fluid volume deficit, or FVD, happens when we lose more fluid than we take in. This can be due to things like excessive sweating, vomiting, diarrhea, burns, or even certain medications.
And I remember from our source material that this can be especially dangerous for vulnerable populations like infants and older adults.
Absolutely. Their bodies are less able to compensate for that fluid loss, making them more susceptible to dehydration and its complications.
Like with the college student who is experiencing those persistent loose bowel movements.
Yes. His case highlights how quickly fluid loss through the GI tract can lead to FVD. If his situation wasn't addressed promptly, those symptoms could have progressed to severe dehydration, potentially even leading to shock.
Wow, so what are some of the key signs and symptoms of FED that nurses should be looking out for?
Well, the most obvious ones are increased thirst, dry mouth, and decreased urine output.
Right.
But there are also some less obvious signs, like changes in vital signs.
Like tachycardia, a rapid heart rate.
Exactly. The heart is trying to compensate for that decreased blood volume. You might also see hypotension, especially when the patient stands up, a sign of orthostatic hypotension.
And what about those subtle changes in appearance?
Yeah.
I remember learning about assessing skin turgor.
Absolutely. Skin turgor refers to the elasticity of the skin. With FVD, the skin loses its elasticity and doesn't bounce back as quickly when pinched. You might also see sunken eyes, another sign that the body is depleted of fluids.
So it's really about putting all those pieces of the puzzle together.
Precisely. And then on the other side of the spectrum, we have fluid volume excess, or FVE, which occurs when the body retains too much fluid.
And this can happen for a number of reasons, right?
Absolutely. Heart failure, kidney disease, liver cirrhosis, even excessive sodium intake can all contribute to FVE. Remember the patient who received too much AVI fluid?
Yes, his case was a perfect example of how fluid overload can lead to serious complications.
Exactly. He was experiencing shortness of breath, a bounding pulse, and we even heard those alarming crackles in his lungs indicating fluid backing up in his circulatory system.
So this is some key signs of FEE, but what are some others that nurses should be aware of?
Edema or swelling is a big one. You might see it in the legs, ankles, feet, or even in the lungs, leading to pulmonary edema, a life-threatening condition.
And like with FED, vital signs can provide some clues.
Right.
We might see elevated blood pressure, a rapid heart rate, and even signs of heart failure, like shortness of breath and fatigue.
Now, before we move on to electrolyte imbalances, there's one more fluid-related concept we need to touch upon: third space fluid shift.
This is where fluid shifts from the intravascular space, the blood vessels, into those unusual compartments we talked about earlier.
Exactly, like the pleural cavity, peritoneal cavity, or even the interstitial space between cells. And while the total body water hasn't actually changed, this shift can lead to a decrease in circulating blood volume, mimicking the symptoms of FVD.
So the body might technically have enough fluid, but it's not where it needs to be.
Precisely. And this is another reason why a thorough nursing assessment is so vital.
Okay, I'm starting to see just how complex this whole fluid balance system really is.
It is. And we haven't even delved into electrolyte imbalances yet.
Well, let's get to those now. These can be just as tricky to manage, right?
You can be. And just like with fluid imbalances, they represent either a deficit or an excess of a particular electrolyte.
And the consequences can be just as serious, affecting everything from nerve function and muscle contraction to heart rhythm and even cognitive function.
We could spend a whole deep dive exploring electrolyte imbalances, but let's focus on a couple of common examples, hypernatremia and hypokalemia, to illustrate just how impactful these imbalances can be.
Sounds good. What is hypernatremia and what causes it?
So hypernatremia, that's a high sodium level in the blood.
Okay.
And it can be caused by a few things: not drinking enough water, losing too much water through sweating or diarrhea, or even conditions like diabetes insipidus, where the kidneys can't conserve water properly.
And what kind of an impact does this have on the body?
Well, think back to osmosis. If that sodium concentration is high in the ECF, it pulls water out of the cells, causing them to shrink and malfunction.
Wow.
This can lead to a whole range of neurological symptoms, from confusion and lethargy to even seizures and coma.
That sounds pretty serious.
It can be, especially in vulnerable populations like the elderly.
Okay.
Now, on the flip side, we have hypokalemia, which is a low potassium level in the blood.
And if I remember correctly, potassium is super crucial for muscle function, especially in the heart.
You got it. Hypokalemia can be caused by things like vomiting, diarrhea, certain medications, even excessive sweating, and it can lead to muscle weakness, fatigue, and even those dangerous cardiac arrhythmias we talked about earlier.
So as future nurses, we need to be extra vigilant in recognizing and managing these electrolyte imbalances.
Absolutely. And it all starts with a thorough nursing assessment.
All right, let's dive into that assessment. What are the key components we need to focus on?
Well, a detailed nursing history is crucial. You'll want to ask your patient about their typical fluid intake and output patterns, any recent changes, and any underlying health conditions or medications that could be contributing to an imbalance.
So if they have a history of kidney disease or heart failure, diabetes, those sorts of things.
Exactly. Those conditions can significantly impact fluid and electrolyte balance. And don't forget about medications. Diuretics, laxatives, even some antibiotics can mess with electrolytes.
It's like detective work, connecting all the dots.
It is. And beyond the history, the physical exam is equally crucial. You'll be looking for those telltale signs we discussed earlier.
Checking for edema, assessing skin turgor, evaluating those vital signs.
Precisely. And don't forget about those lung sounds. Crackles can indicate fluid overload, while diminished breath sounds might suggest dehydration.
And we can't forget about daily weights, right?
Yes. One of the most valuable tools in your nursing arsenal. Daily weights provide a far more accurate picture of fluid balance than even the most meticulous intake and output measurements.
Because those can be so subjective.
Exactly, but weight changes, especially rapid fluctuations, are a strong indicator of fluid shifts. So if a patient gains or loses a significant amount of weight in a short period of time, that's a huge red flag.
So we've gathered all this information for the history, the physical exam, the daily weights. What else do we need to consider?
Lab values. Electrolyte panels complete blood counts, and those all-important arterial blood gases, or ABGs, provide a wealth of information.
Those ABGs can be a bit intimidating at first, but they're really essential for evaluating that acid-base balance.
They are. Don't worry, with practice, you'll become pros at interpreting those ABGs. But for now, just remember that they give us crucial information about the pH, the carbon dioxide and bicarbonate levels in the blood, all key indicators of acid-base status.
Okay, so we've got all this assessment data. Now what? What are some of the nursing interventions for managing these fluid and electrolyte imbalances?
Well, the specific interventions will depend on the type and severity of the imbalance, but some common strategies include dietary modifications.
Like restricting sodium for patients with FEE, or encouraging potassium-rich foods for those with hypokalemia.
Exactly. And fluid management is another key intervention. We might need to increase fluids for dehydrated patients or restrict fluids for those with fluid overload.
And I imagine IV therapy is often necessary to quickly replenish those fluids and electrolytes or correct those imbalances.
Absolutely. You'll be learning all about different types of IV solutions and their specific uses in your nursing program. And we can't forget about patient education.
Right. It's so important to empower our patients to really understand their condition and be active participants in their care.
Right. We need to teach them how to manage their fluids and electrolytes at home and how to recognize the signs and symptoms of potential problems so they can seek help early on.
Now, before we wrap up, there's one more special case we need to address, and that's blood transfusions.
Yeah, blood transfusions can be life-saving.
Right.
But they also carry risks.
Right. So we need to be extremely careful ensuring compatibility monitoring for any adverse reactions and providing supportive care throughout the process.
Exactly. You'll be learning all about the ins and outs of blood transfusions in your nursing program.
Well, we've covered a lot of ground in this deep dive, from the basics of fluid and electrolyte balance to the nursing assessment and interventions.
We have.
It's clear that this is a complex but fascinating subject.
It is.
And it's one that you'll continue to build upon throughout your nursing career.
Absolutely.
As you embark on your journey as future nurses, remember that understanding fluid, electrolyte, and acid-base balance is fundamental to providing safe and effective care. It's all about recognizing those subtle cues, intervening proactively, and always advocating for your patient's well-being.
And before we sign off, I'd like to leave you with a final thought to ponder.
Okay.
As you delve deeper into pharmacology, think about how the medications you're learning about might impact a patient's fluid and electrolyte status.
That's such a good point. It's all interconnected.
It is. And as future nurses, you'll be the ones ensuring that your patients receive the best possible care, keeping those fluids, electrolytes, and acid-base levels in perfect harmony.
Thanks for joining us on this deep dive.
Yes, thank you.
We hope you found it insightful and engaging.
We did too.
Until next time, keep learning.
Keep learning.
Keep exploring.
Keep exploring.
And keep those nursing brains buzzing.